So when we think about adolescence, it's a unique and formative phase of development. There are multiple and rapid changes that are happening, but it is also a period of vulnerability. Half of mental health issues actually arise before the age of 14. If you look at some of the illnesses that happen in adolescence, depression is the leading cause of burden of disease in adolescence. Suicide, second leading cause of death in 15 to 29 years old. And if these are left untreated, they extend into adult life and thus impacting educational attainment, employment, difficulty in relationships, or even parenting for the younger generation. So considering the importance of mental health problems in adolescence, it's essential that we invest today in promoting mental health, preventing mental disorders, not only for today's generation, but for our future generation. There are many things that young people can do about taking care of their mental health. For example, they can take care of their basic needs, having good sleeping habits. They can be active and engaged. And when I say active and engaged, it's not only about physical activity. It's about engaging in meaningful activities such as school clubs, organizational clubs, or even activities in communities, and staying connected, which is very important, communicating with a trusting adult, a friend, a parent, or a teacher. Sometimes adolescents, they will engage in risk-taking activities and as a way of overcoming some of the challenges. Now, this is a short-term change, but in long term, it impacts on their mental health and well-being. And lastly, it is very important, if there is any concern about their mental health, they should speak to a trusted adult and seek some further support, because many of these problems and issues can be managed if detected early. Schools have an important role in promoting mental health resilience. For example, in schools you can have safe and secure environment, an environment that is promoting their psychosocial health, having life skill training programs, having programs that improve on skill building such as cognitive skills, problem solving skills, and this will decrease the mental disorders and problems. And also, the schools can offer help in case a mental health problem is detected in an adolescence. And similarly, parents are very instrumental in promoting the mental health of adolescents, having stable, positive emotional connections at home, having positive attitudes, for example, no smoking at home, communicating with adolescents, and giving them independence, engaging with adolescents. These are some of the things that parents and schools can do to promote the mental health of these young adults. It is very important that all of us recognize what are the signs of poor mental health in adolescence. And we know that adolescents can be moody, but sometimes, for example, keeping an eye on whether their mood is lower, sadder, they are more angry, more tired, they are avoiding some of the activities, some of the people. These are signs of poor mental health. Or they are engaging in some of the risk-taking behaviors. Again, it means they may be having a risk of poor mental health. The other thing is that knowing that one can do something about it. So for example, talking, it's very important. And the communication can start with a simple question. You are not yourself lately. What can you do about it? And third, if you feel that an adolescent is feeling guilty, worthless, or has been thinking of harming themselves, do seek help immediately. Speak to a trusted adult or to go to a mental health service, because many of these suicides, they can be avoided in this age group.